Hi guys, it's me again, Gareth Williams, specialist orthodontist. Fairly commonly during a course of orthodontics, especially when we're dealing with teenagers, we will come across a situation where dental trauma has been sustained to the front teeth. This is because we're dealing with a number of teenagers who play contact sports more often than not, and that's the cause of the trauma. Unfortunately, we also see patients who are victims of assault, and we do see these traumas in adults as well, although at a lower incidence. The most important thing as an orthodontist is we need to first of all investigate the vitality of the teeth involved. So that's determine how badly damaged these teeth are, whether they've just had a little knock and they're what we call concussed, or they've had a little knock and a movement, what we call subluxation, whether they have a knock and a noticeable movement, what we call luxation, be it lateral, intrusive, extrusive, so that's the direction of movement, or whether you had what we call avulsion, which is a tooth that's been totally knocked out of the mouth and either lost or replaced in the socket. All of these unfortunately need very sensitive orthodontic management, because once that tooth has had a trauma, the risk of continuing to move it in braces tends to worsen its outcome. So for that reason, once you report a trauma to us, more often than not, we will have a rest period on the movement of that tooth, whether that involves taking off the braces or just leaving the braces on in a passive state, that is without active wires. We will also likely refer you to your general dentist, who will monitor the progress of that tooth, because if it's on its way to dying, give it every chance to live so that you don't need a root treatment or removal of a tooth. The rest period changes based on the most recent evidence, like everything in medicine and dentistry, and currently we're at about 9 to 12 months of a rest period. So you might find that if you have a knock, it can feel a bit unfair. You've already had something that's gone wrong, then you come in and we're saying, well, listen, we've got to leave you for 9 to 12 months. And it can sometimes be a bit upsetting for people because it sort of feels like a double trauma, almost like you're being punished for the first one. It's not the case, and often you look back on it, you'll be glad you had that rest. But it is all about protecting you and protecting the health of those teeth, giving you the best possible chance that those teeth heal and are totally healthy by the time we finish brace work. Also, if you find these videos at all useful, you think friends would find them useful, you think they'd help inform other people considering orthodontics, even if it's not under my care at all, feel free to subscribe, click the notification bell and share it around, because I think that hopefully this can help answer a lot of questions that a lot of people have. Thanks for listening. Bye now.